Okay, thank you very much, and thank you for coming here this morning. We're here for a pretty simple reason, and that reason is that each year 10 million children die, and those 10 million children die in the poorest countries of the world, and they die from easily preventable or treatable diseases. We know that a quarter of those deaths, 2.5 million of those annual deaths, could be prevented simply by the use of the vaccines we have in our hands today and the vaccines that we're going to have in the next few years to come. So this is a global agenda. Your children and my children, they're protected. We have access to some 20-odd vaccines for our children, but the poorest parts of the world for the past half century have had access to only 6 vaccines, and they've been working with relatively weak health services to deliver those vaccines. We take it for granted. That's the challenge, and that's why GAVI was created here in Davos in 6 years ago. It's a unique public-private partnership, and it was created to bridge that inequity, that gap between what we have and take for granted and what the poorest countries do not have. And it was launched with a very generous contribution from the Bill and Melinda Gates Foundation, and they have continued to be one of our strongest and our longest-term supporters. And on the basis of that support, we now have 17 governments that now support us and finance GAVI from the West. So with that finance, what have we achieved? It's been pretty remarkable. In the last 6 years, we've focused on a pretty clear strategy. That strategy has been about boosting the coverage of existing vaccines in the poorest parts of the world, introducing new vaccines, and then leveraging the market to both affect the price of those vaccines so that they become more affordable to the poorest countries, but that also we create a market that encourages industry to introduce those new vaccines, particularly for the poorest part of the world, and introduces them sooner. So in that very short period of time, GAVI has been able to immunize an additional 138 million children. We prevented 2.3 million future child deaths and 600,000 alone in 2006. We've introduced more than 1 billion auto-disabled syringes into the poorest parts of the world. These are syringes that, once used, have to be thrown away so that they cannot transmit blood-borne diseases such as HIV and hepatitis B. And we've created a market where it was felt a market didn't exist, a market in the poorest parts of the world, which has increased competition, which has increased the volume of production, and has dramatically driven down the prices of some of these important vaccines. One of the most exciting success stories that I want to share with you today with the data is what has happened in Africa, in sub-Saharan Africa. The latest data shows that 73% of all children born in Africa now are covered by vaccines. That is an absolute remarkable achievement, which 5 years ago when GAVI was launched, nobody would have believed that was possible. So in the poorest parts of the world, they are now achieving results better than in South Asia and better in some of the cities of Europe, quite frankly. So this shows what is possible. That's a fantastic result. It's a success story, and we need to hear more of these success stories from Africa. We tend to hear only the negative stories, but there is tremendous success and tremendous potential. But getting the vaccines out, if we want that long-term sustainability, is not going to be enough. That's why this year GAVI has opened up financial support, $500 million to strengthen the delivery systems, the health systems that are going to provide those vaccines in the poorest parts of the world to get that long-term sustainability. And it's not rocket science, quite frankly. What is a health system? A health system is no more than well-motivated, well-trained staff in sufficient numbers with the drugs and vaccines that they need to treat and prevent disease, and working in an infrastructure, that's the facilities and the transport, that enables them to deliver and is close to the people that needs those services. But that's weak in Africa, and that needs to be built, and that's why GAVI is moving in that area. So we're at a tremendously exciting time, not only for GAVI, but also more broadly for health and development. GAVI, we have proof of concept. GAVI works. GAVI delivers results. We now have a range of new and very exciting vaccines in the pipeline that can make a tremendous difference, and we're raising the finance, so we need additional finance to deliver those. So now is the time to go to scale. What we have the potential to deliver now is improvements in child health in less than a generation that took 150 years to achieve in Europe. Thanks very much.
Thank you, Julian. Melinda, would you like to
Sure.
say a few words? So Bill and I are pleased to be here to highlight the remarkable success of GAVI, which Julian has just overviewed for you. And I think to put it in context, we have to remember that before GAVI was created in 2000, the vaccination rate across the world was declining, and it was a sad state of affairs, frankly, when we started to look into this issue. When Bill and I first heard about this, we kept saying to ourselves, how could that be? We have all these incredible vaccines for our children in Europe and in the United States, but they don't get delivered to the developing world. And I'm pleased to say, as Julian highlighted, that since GAVI's inception, vaccination rates are now on the increase around the world, and particularly to see the progress in places like Africa, I think, is really quite heartening. It also shows us that we put our best hearts and minds to something as a world. When you bring nonprofits and business and governments and great leadership together, such as the GAVI organization, you can do great things. And I think that's what we're here to highlight today. Still, there are many, many children in the developing world who die of vaccine-preventable diseases. Julian went through some of the numbers of what we still have to accomplish. And I want to say that I think every one of those deaths is unacceptable. When you think that we have the vaccines, we have the technology today, we simply have to get them out there. When I'm out in the field, I'm amazed to watch mothers come. They know when these vaccination days are. They're spread, and even in the rural areas, they know when to come. They'll stand, the news is spread of it, they'll come, they'll stand in line. And I've been in so many villages where it's not a vaccination day, and I'll just ask a mother to see her child's vaccination card, and they're always so proud to bring them out because they know the difference that vaccines make for their children. So I think as a world, for us to sign up for this task is really quite remarkable, and I'm excited to be here to share the results today.
Thank you very much. Bill.
Well, GAVI was our first big grant in global health, $750 million commitment that just in the last few years we've doubled that because of the great success. And it's almost difficult, I think, for people to appreciate when you're talking about saving millions of lives. You know, if we'd saved 100 lives, we'd, have the pictures on the wall. We would have flown a few of them here. We could all, think, wow, that person's life was saved. And it's almost harder to relate to the larger it is, millions of lives. And we know the impact of saving those lives is to create all sorts of other benefits. I mean, it's an amazing thing, but it also reduces the population growth rate, makes it easier to feed all the children, provide the education, and all the things that are important. GAVI, when it started out, we were the primary backer, but year by year, the generosity of governments coming in as donors has been absolutely fantastic. Some have come in on a sort of straightforward year-by-year donation basis, people like Norway. Others have come in with a creative financing concept, which is an international financing facility for immunization that's gotten commitment levels up a lot. Also, because the money's here, the ability to sit down with the vaccine manufacturers and say, we're going to be buying over these next 5 years, so go ahead and build a plant for a pentavalent vaccine, that supply chain is far more efficient. The planning together can get done with that predictability. We don't know for sure how quickly we'll be able to add new vaccines. Certainly I'm an optimist. I believe that for a lot of things that relate to diarrheal diseases and respiratory diseases, we will have additions. There's already work going on with the GAVI's involved with relating to a pneumococcal vaccine. There's work going on that relates to a rotavirus vaccine. So certainly over the next 5 or 10 years, we will be adding more vaccines, and so the number of lives saved will go up very dramatically. And so, this is a story that should be well known. It's an amazing thing, and I really want to congratulate GAVI on the great work they've done.
Thank you very much. Time for some questions now. We really do have a reasonably short time, so I need to keep the questions on this topic only. Could you indicate you want to ask a question? We have a microphone. Lady here, please. Say who you are and where you're from, please. Thank you very much.
Hi, good morning. This is Carol Guerrero from W Radio. This is a radio station from Latin America. And I would like to know, you've been talking about the GAVI Alliance for Africa and some Asian countries. Do you have any plan for Latin American countries?
Julian, I think.
Yes, I can answer that straight away. We already work in Latin America. We work across the 70 poorest countries across the whole world. Our mission is to work in the poorest countries, and that includes Latin America.
Ben, question.
With Reuters. Can you give us a bit more detail on just how much you managed to get prices down on vaccines and what you expect in future?
Yeah, that's a good question. It depends on the vaccine and the stage of its development. Perhaps our biggest success has been with hepatitis B, which probably the price has been halved and it's now coming down to tens of cents a dose. This is a long-term agenda, and for some of the newer and more exciting vaccines, we're prepared to subsidize fairly high prices, but with a clear intention to get those prices affordable. Essentially, for the poorest countries of the world, they're going to have to be able to manage with vaccines that come down to $10 a dose. At the moment, we are talking about vaccines of cents a dose. Many of the vaccines we use in the richest parts of the world come in at maybe $100 a dose. So that's the kind of changes that we need to see. But we're achieving that, and we will achieve it.
Question, yeah, gentlemen.
Kjell Louis from Jyllands-Posten in Denmark. Saving the lives of children is one thing. Another thing is the kind of life that they live after they have been saved. In what ways do you plan to use your foundation with the money of Mr. Buffett to sort of help in that area?
So some of the work that we're starting to do with the foundation is in an area that we call global development. So you've heard us talk a lot about global health, which GAVI fits into that. We're now starting to surround some of our work, and I'll give you just one example, which is looking at an institution or an area like microfinance, which has been a robust industry for 20 years, but there's still very inaccurate, uneven data about how many households are served by something like microfinance. It's somewhere between 30 million and 100 million households. But we need to get that number up to hundreds of millions of households that are involved in micro-lending. And if you can get a family more stabilized because they have a stable income, because they have a small loan, or even branching out into some things like micro-insurance or having savings, I think that will help people lift themselves up so that they not only have great health, but they can start to give their child an education or have a stable means of income. So those are some of the areas we're starting to branch into.
Yeah, I'd add to that when you save lives, that has an incredible value in and of itself. And what everything shows is that as you bring health improvements to a community, that reduces the population growth, because parents without any social security type thing are making sure that they're going to have several of their children live into adulthood. And so that's why you would be able to bring down all of the challenges of education and nutrition and literacy as you improve health. And that's been seen everywhere, and that's an add-on benefit. And then we complement that, as Melinda said, with the agriculture and microfinance and other plans that the Buffett gift, which is so fantastic, is allowing us to scale up in a very substantial way.
Yes.
Ugo?
Yes, it's working.
Works. Ugo Tambelli, Sole 24 Ore of Milano. Infrastructures, roads, doctors, governments, programs, local programs. I've been told there are much more Kenyan doctors in Birmingham rather than in Kenya itself. So how can you deal with this issue, considering that you said you distributed 73% of the African children have been vaccinated? How have you done this? Thank you.
Particularly for immunization, that shows that there is an infrastructure that you can build on, and it shows that you're often working with paramedical people, and you're working with not the doctors and the senior nurses, but with appropriate community health workers and nurses that work in those communities. So there's an infrastructure you can build on. But you're absolutely right. The human resource capacity crisis of sub-Saharan Africa in particular, where those doctors work either in capital cities or in richer neighboring countries or in the West, is a major challenge. I'll give you one anecdote. In Zambia, the Zambian government looked at this quite closely and worked with the Dutch government to then talk to Zambian doctors in neighboring African countries where they'd gone and ask them what difference is required to enable you to come back and work. Because in Zambia at that time, they only had 10 doctors working in rural areas. And it was pretty simple stuff. It was, we need a modest amount of finance to allow us to rent a reasonable accommodation when we're in a rural area. We need to know we won't be there forever. We need to perhaps have a loan to buy a car. We need to have a telephone, and our children need some schooling when we're working there. And we need a bit of support to do that. And they worked out a package which came to actually 3,000 euros per year. And they introduced that package, and within a year they had 30 Zambian doctors returning from neighboring countries to work in rural areas of Zambia. So it's not as expensive as some people might think, and simply by talking to people about what is it that's going to make a difference, and to do some clever, innovative financing around that can make that kind of difference. So there are solutions.
Another question. I can't believe that, yes, gentleman there.
It's John Zarakostas for the British Medical Journal. I was wondering if there are any plans to put in place manufacturing capabilities in sub-Saharan Africa and to inject greenfield finance for that. Thank you.
Speaking from the GAVI point of view, we already buy a substantial amount of our vaccine from developing countries, notably from India and increasingly from countries such as Thailand and Brazil. In sub-Saharan Africa, at the moment we're not purchasing much from there because there isn't the capacity to do that, but that will come. As the market is there, companies are going to invest in places where you can get this kind of capacity to build up. So I'm pretty optimistic that by working through a market-driven mechanism, we don't invest directly in building capacity, that the market will respond to where it can be efficient.
Sure. In sub-Saharan Africa, the major manufacturers don't see it as a vibrant market and haven't been putting plants outside of South Africa.
Yeah.
So I was wondering if you're planning to do some greenfield finance.
We don't plan to do that directly, but I think that's going to change. I think we've demonstrated as a market. We've been successful for 5 years. We're going to be there for the next 15 or 20 years, and that's what industry responds to. So that's going to happen.
Yes.
Margaret Heckel from Welt and Weltamtstag in Germany. You said that governments are coming into your initiative. Do you want to give it over to the governments after a while, or do you want to stay there in there permanently?
I'm sure that we'll be donating to GAVI forever. We'd like the percentage that comes from the governmental side to continue to increase, but just to allow GAVI to get bigger and do more. We've been on a very good growth curve. The recent commitments allow GAVI to continue to grow, but we still want to and need to attract more money. And so that's partly why it's important to get the good news out there about what we've done. But vaccinations are, a miracle thing. And as we can add, someday perhaps a malaria vaccine, someday a TB vaccine or an AIDS vaccine, the infrastructure and the capacity that GAVI has built out, all justified by the millions of lives they're saving with the vaccines we have today, that's what we'll be able to take advantage of and take those new vaccines in. And so if you look out, in the 10 to 20 year time frame where you might have some of those additional vaccines, the size of GAVI hopefully will be dramatically bigger than it is today, and both we and the rich world government should all step up in a big way.
It's probably also worth pointing out that our initial investment in GAVI was $750 million over 5 years, and our second, and we thought it was such a good investment. Excuse me?
Yeah.
And we came back, and our second investment was $750 million over 10 years. And so what we try to do is to demonstrate, get the organization up and running, show early results in these first 5 year periods, so that then others will, and what you're seeing, want to come in. And that, I think, is how you'll see many of our investments be made. We'll continue to be very supportive of GAVI over many, many years, as Bill said. But I think that gives you a sense of showing the early commitment, and now so many others are going to come in that that'll be the way we can finance in the future.
Okay, we have time for probably one or maybe two more questions. So, yes, sir, gentleman in the front here. Can we just let the microphone through? Thank you.
Ulf Hellström, Aftenposten. I'd just like to ask Mr. Gates, how will your time with GAVI change in the years to come? I mean, your own professional life is changing in the next couple of years, isn't that right? Could you elaborate a bit? Thank you.
Yeah, I'm full-time at Microsoft, and my foundation work is part-time. And then in the middle of 2008, I'll work full-time on foundation-related things. I won't actually run the foundation. It's got a great CEO who does a great job there. But I'll, just like Melinda, who's increasing her time as well, I'll get more time. For example, I haven't visited the manufacturers. I haven't gone down to see, I haven't gone to Brussels or to see Serum Institute in India or see some of the new vaccine plants that are coming online. I haven't gotten as much chance to meet with the doctors and talk to them. For example, today vaccines still require refrigeration, and we have some grants out that are risky and no guarantee of success, that we might be able to formulate these vaccines in such a way that you don't need the refrigeration, what they call cold chain, and that would allow us to get the cost down somewhat and the coverage up somewhat. And so sitting down with scientists and asking them, okay, how does your approach to avoiding refrigeration, how does that work, and how likely is that to succeed? So I will get some additional time on these topics, and I'm looking forward to that.
Okay, thank you very much indeed. I look forward to hearing more good results next year. Enjoy the rest of the day. Thank you.
Thanks, Mark.
Thanks.